Hello, doctors. This is Dr. Baliga. This podcast belongs to a group of 11 podcasts on asthma, derived from an outstanding chapter in Baliga's textbook of internal medicine, available at www.mastermedfacts.com. It's authored by Dr. Christopher H. Fanta, MD, who is the director of the Partners Asthma Center, a collaboration of allergists and pulmonologists at the Brigham and Women's Hospital and Mass General Hospitals and affiliated community hospitals in the Boston area. He is a member of the Pulmonary and Critical Care Division at the Brigham and Women's Hospital and a full professor of medicine at Harvard Medical School. He is the co-author of the Harvard Medical School Guide to Take Control of Asthma, published by Simon & Schuster in 2004, and the Asthma Educator's Handbook, published by McGraw-Hill in 2007. After listening to this series of podcasts, the listener should have a solid foundation on the topic of bronchial asthma. Multiple choice question. A diagnosis of asthma is suggested by a characteristic history of intermittent cough, wheeze, shortness of breath, and/or chest tightness. The following test is most helpful in confirming a suspected diagnosis of asthma. A. Chest X-ray. B. Serum IgE or immunoglobulin E. C. Allergy skin testing. And D. Spirometry. And the answer is D. Spirometry. To confirm the diagnosis of asthma, one needs to demonstrate the property of variable airflow obstruction. This physiologic observation is made by pulmonary function testing, specifically spirometry, measurement of an elevated serum IgE, peripheral blood eosinophilia, or skin test sensitivity to common environmental allergens would suggest allergic sensitivities or atopy, but it would not specifically identify the airways as the target organ for this allergic sensitivity. In addition, many adults with asthma are non-allergic. The chest X-ray is typically normal in asthma or shows only non-specific hyperinflation during an asthmatic attack. This podcast was derived from an outstanding chapter on asthma authored by Dr. Chris Fanta, MD, who is a professor of medicine at Harvard Medical School, and he's the director of the Partners Asthma Center, a collaboration of allergists and pulmonologists at the Brigham and Women's Hospital and the Mass General Hospital and the affiliated community hospitals in the Boston area. He's the co-author of the Harvard Medical School Guide in Taking Control of Asthma and the Asthma Educator's Handbook. This chapter was derived from Baliga's textbook of internal medicine, available at www.mastermedfacts.com. After listening to the 11 podcasts on this topic, the listener should have a solid foundation in asthma.